Tired of medicines that don't work? Let's heal your body the natural way. I'm Dr. Zhang Ming. Welcome to Healthify Remedies. Today we're going to talk about a topic I discuss with many of my patients, an issue that affects a lot of men once they pass the age of 40, but is seldom spoken about in detail, a gradual slowdown in libido. You might still feel attracted to your partner, still care about intimacy, but you notice the drive isn't the same. The spark seems weaker. You wonder, is this just aging? Or is something wrong with me? Here's what I want you to know. Yes, your body is changing. But no, it doesn't mean you're done. In fact, once you understand why this happens, you can take control and restore much of your vitality. So in the next 20 minutes, we'll cover what the research shows, the different underlying systems, hormones, brain, circulation, emotional health, a real-life example to illustrate it, and practical steps that men over 40 can do right away to bring their drive back. Let's get started. What the evidence says. First, let's look at the data. Age alone doesn't explain everything, but it is a strong factor. A study on men aged 40 to 70 found that about 52% of men in that age range described some degree of erectile dysfunction. Another longitudinal study of middle-aged men showed that the number of erections per month declined by roughly 3 in men in their 40s, 9 in men in their 50s, and 13 in men in their 60s, over a 9-year period. In terms of low libido, reduced sexual thoughts, fantasy, interest, one study reported about 15% of men in population-based surveys reported hypoactive sexual desire. And it's not just men saying, "I'm just not in the mood." One cross-sectional study of middle-aged and older men found that decreased libido was closely associated with declining testosterone levels, among other factors. So the take-home here, yes, libido decline after 40 is common, but the reasons are multifactorial. Aging is the context, not the sole cause. Real-life case example. To make this more concrete, let's imagine a case. I'll call him Mr. Anderson, age 46. He's based in the UK, has a busy management job, is married for 15 years, 2 teenage children. He's in reasonably good shape, exercises occasionally, but over the past year he's noticed less interest in sex, more fatigue, less spontaneous desire. He still loves his wife, still finds her attractive, but the physical drive just isn't there. He thinks, "I'm just busy, or maybe I'm getting older." He shrugs it off. But over time it begins to affect his self-confidence and his relationship. On examination, we check his blood pressure, BMI, which is slightly elevated at 28. His testosterone level comes back slightly low for his age. His sleep is poor. He often works late and gets 6 hours. He admits he's stressed, drinks 3 to 4 glasses of wine a night, sits for 10 hours a day. Through this example, you see a mix of subtle changes: hormones, lifestyle, brain and stress, circulation. This is typical. And the good news, with the right plan, we can reverse much of this. Hormonal and endocrine factors. Let's focus first on hormones, because they're often cited, and for good reason. Your testosterone levels begin to decline slowly after the age of about 35, maybe around 1% per year in many men. This doesn't mean you lose it all overnight, but it means over 10 to 15 years there can be a significant drop. Reduced testosterone means less libido, less spontaneous erections, less morning hardness, less sexual thoughts. A review article found that reduced sexual desire is the most important correlate of male hypogonadism. However, here's the nuance. It's not just testosterone. Many men in that age group have normal testosterone, yet still have low libido. That means other systems, brain, blood flow, lifestyle, are playing a role. Other endocrine issues, thyroid problems, hyperlactin, metabolic syndrome can all reduce libido. So in practice, when we see a man over 40 with low libido, we check hormone panel, but we also look at broader health factors. Brain, nervous system, and psychological factors. Next, the brain and nervous system. Libido begins in the brain. Attraction, sexual thoughts, desire, all mediated by brain circuits, neurotransmitters like dopamine, oxytocin, serotonin. If your brain is overloaded, high stress, poor sleep, anxiety about performance, these signals are suppressed. Chronic stress elevates cortisol, which interferes with testosterone and also dampens sexual drive. A major clinical medical source states that mood, anxiety, fatigue, Sleep disorders are common causes of low libido in men. Also note, some medications commonly used in men age 40 plus, antihypertensives, antidepressants, antipsychotics, can reduce libido as a side effect. So even if hormones look okay, your desire may still be low because your brain is saying, not now. Improving brain health, less stress, better sleep, proper mental health is essential. Circulation, vascular health, and physical body. Now we come to the physical body, because sexual arousal and performance depends heavily on circulation. As men age, blood vessels lose some flexibility, arteries may become stiffer, and microcirculation may decline. That means less robust blood flow to the tissues involved in arousal. In fact, the overlap between erectile dysfunction and low libido is high. Cardiovascular risk factors, diabetes, high blood pressure, high cholesterol, obesity, show up in many men with low/libido or sexual dysfunction. In one study on decreased libido in older men, urinary/voiding issues were noted as independent risk factors, showing how metabolic, vascular, and urinary systems link into libido. What this means, if you sit for long hours, don't move much, have high BMI, or poor circulation, your libido is likely affected, not because you lost interest, but because your body is less responsive. Therefore, good cardiovascular health equals good sexual health. Lifestyle, relationship, and emotional components. Now let's explore the lifestyle and relationship side, often overlooked. Here are some key lifestyle triggers for low libido after 40. Poor sleep. Less than 7 hours per night disrupts hormone recovery and libido. Evidence reviewed in sleep/hormone studies. Excess alcohol, smoking, high sugar/processed diet. These damage circulation, affect hormones, impair mood and energy. Sedentary behavior. Long sitting hours equals poor circulation, poor metabolic health. Relationship fatigue and emotional disconnect. After years together, novelty may fade, emotional intimacy may drop, dopamine responses reduce. One resource notes that relationship issues are a common cause of male low libido. Self-image and confidence. When men feel less vital, less attractive, or less in control, desire drops. In Mr. Anderson's case, you remember, busy job, late nights, too much sitting, moderate alcohol, low sleep, mild overweight, higher stress. All of these added up. The good news, these are all modifiable. Even small improvements lead to measurable changes. What you can do, practical steps for men over 40. Let's move into action. If you're a man age 40 plus and you feel your libido is not what it once was, here are clear steps to take. 1. Sleep hygiene. Aim for 7 to 8 hours of quality sleep. Go to bed and wake up at consistent times. Avoid screens 30 minutes before bed. Good sleep supports hormone production, brain recovery, and circulation. 2. Nutrition and hormone-supporting diet. Include healthy fats, olive oil, eggs, salmon, avocado, nuts. These support hormone synthesis. A meta-analysis showed low-fat diets may reduce testosterone levels in men. Avoid excessive processed sugar, refined carbs, high-dose alcohol. Ensure you get adequate zinc and magnesium. These minerals are linked to testosterone and sexual health. 3. Exercise and movement. Strength training, 2 to 3 times per week, is especially effective at maintaining testosterone, muscle mass, and circulation. Add moderate aerobic exercise for cardiovascular health. Avoid excessive endurance training without rest. Some data shows very high-intensity training is associated with lower libido. The study in long-distance athletes. Also reduce sitting time. Aim to stand/take short walks every hour. 4. Stress and mental well-being. Incorporate daily stress reduction tactics. Deep breathing, short meditation, outdoor walk, hobbies which disconnect you. Check for sleep apnea if you snore or feel fatigued. Untreated sleep apnea reduces testosterone and libido. If you feel depressed or anxious, speak with your physician or psychologist. These affect libido more than you realize. 5. Check UPS and medical review. Get a health check. Blood pressure, lipids, blood sugar, BMI, hormone panel, including total and free testosterone, LH, prolactin, TSH, for men with persistent low libido. Studies suggest hormone and metabolic diseases are common background. If you have underlying conditions, diabetes, hypertension, obesity, sleep apnea, manage them. Improving those often improves libido. 6. Relationship and intimacy. Talk openly with your partner. Reintroduce novelty into your relationship, new date night, new interest, physical touch outside sex. Focus on emotional connection, not just performance. A strong bond enhances oxytocin and desire. 7. Mindset shift. Understand. Aging doesn't mean loss of sexuality. It means evolving. You're not obsolete, you're experienced. Embrace this stage as one of maturity and control. Many men in their 50s and 60s have revived strong libido by following these steps. Yes, libido tends to slow down after 40, but that does not mean you have to accept low drive as your new norm. The slowdown is the result of changes in hormones, brain signaling, circulation, lifestyle, and emotional/relationship factors, all of which we can address. If you commit to sleep, nutrition, movement, stress management, medical review, and emotional connection, you will see improvements. I'm Dr. Zhang Ming, and I encourage you, don't wait. Start today. Your vitality is worth the attention. If you found this video helpful, please like, share, and subscribe. Here's to renewed energy, renewed desire, and a stronger you. Thank you.